She can't crawl out of her bed, can she? I'm sorry.
All right, so ACL injuries can be very costly and detrimental to an athlete's career. For starters, the average cost to repair an ACL injury is around $17,000 after surgery and therapy. And athletes can be sidelined for months or longer, leaving them out of an entire season. And not to mention, the actual ACL, when it is torn and repaired, at the very most, only about 80% of its strength will be regained. So today I'm going to tell you guys how to first identify an athlete who's at risk for an ACL tear or injury. And then two, I'm going to teach you some neuromuscular exercises to help prevent an accident with the ACL. First of all is recognizing an athlete who is at risk for an ACL tear. When Dr. Benjamins viewed some videos of many ACL tears, he found that a lot of them had some things in common. One of them is a term called dynamic knee valgus. And this is when the hip is adducted, the femur is internally rotated, the tibia is externally rotated, and the foot is everted, so it looks like this. So an athlete's leg is in this position when it is injured. And 80% of these injuries occur when jumping, landing, cutting, or changing directions quickly, according to Dr. Duranzi's research. So what can we do about this? Well, one thing that we can do, that is the most important thing, is neuromuscular training. Dr. Meyer identified 4 deficiencies in pathology that could be corrected to help prevent an ACL injury. The first one is quadriceps dominance. Now when landing, some athletes tend to use their quadriceps more when they land. This causes a problem because the quadriceps is attached to the anterior aspect of the tibia, which causes it to slide forward on the femur, which puts the ACL at risk. So we must strengthen the hamstring and teach the athlete to use the hamstring when lowering and jumping, because it's attached to the back of the tibia, which will pull it back into place, keeping it in line. So how we do this is we'll do jumping exercises with an emphasis at the bottom, keeping the knees bent past 90 degrees and pausing at the bottom and the shoulders back. This will activate the hamstring. Another problem is leg dominance. This one is when one leg is stronger and utilized more than the other one, putting more force on it, or that dominant leg causes the other leg to be weaker. So how we correct this is again by jumping exercises, beginning with double leg jumping exercises, where this body's center of gravity needs to be directly in between both feet, and the shoulders need to be behind the knees. And once the athlete attains symmetry in these double leg jumps, then they can use single leg jumping exercises to isolate an egg and keep from compensating. Another factor, the third one factor that may cause an ACL injury, is ligament dominance. Now this is when an athlete allows gravity and the ground forces to dictate the direction their body moves instead of using their musculature to control the movement. So when an athlete plants, their leg will get kind of wobbly instead of them actually using the musculature to come down. So how we correct this is by using eccentric motion, that is the downward motion of the jump. So we can do this with various box jumps, jumping off the platform to a lower area. And the eccentric, the lowering motion, is emphasized. So the lowering must be slow and a slight pause at the end. And the final problem that athletes have when they have an ACL tear is trunk dominance. This is when their body is allowed to move in the direction of their force away from the vector of their leg. So when planting, instead of keeping their body in line with their leg and using it to slow down, their trunk goes off that vector, causing forces to move in different directions of their knee. So we do this we correct this with various core exercises and upper trunk stabilization exercises. And if we could correct all 4 of those things, research has found that these programs reduced the risk of an athlete's ACL injury by 48%, according to Dr. Hewitt. Now this is quite significant. So I've already told you about the cost of an ACL injury, how to identify it, how to prevent it. Now, if you're athletes, you have family or friends who are athletes, now you know how to identify if they're high risk and how to help them prevent an ACL injury. Thank you.